My name is Dr. Mansoor Ahmed and I am from Department of Physiology. Now we are studying pulse. This is our practical of pulse, and this is part A of practical pulse, or I repeat, this is part A video clip of practical pulse. So we will discuss in this practical the examination of the pulse, the different characters of the pulse, and different rhythms of the pulse, different rates of the pulse, and volume and delayed pulse. And we will be discussing, we will be calculating these, we will be writing these, assessing the circulatory function of the body by assessing the pulse. So arterial pulse, as you know that we take the pulses from the arteries, so we take the pulses from the arteries, so it is known as arterial pulse. The arterial pulse is defined as rhythmical expansion and collapse of arteries produced by pressure variations at the root of aorta, which are propagated through arterial system to the periphery. There are 3 points in this definition. The first point is that the arterial pulse is defined as rhythmical expansion and collapse of arteries. As you know that when the blood moves from aorta to other arteries and then to the peripheral arteries, then there is the rhythmical expansion and collapse of arteries occurs. Rhythmical expansion and collapse of the arteries occurs. And why this occurs? Because the second part is pressure variations at the root of the aorta, produced by pressure variations at the root of the aorta. It occurs due to the pressure variations produced at the root of the aorta. The third part is which are propagated through arterial system to the periphery. Basically, it is rhythmical expansion and collapse of arteries due to produced by pressure variations at the root of the aorta, which is then this rhythmical expansion and collapse propagated through arterial system to the periphery. This is the definition of the arterial pulse. The presence or absence of main arterial pulses are generally examined to evaluate the status of the circulatory system. And we examine different main arterial pulses, and this assessment gives us the evaluation of the circulatory system, as the pulse rate is the accurate measure of the heart rate except in conditions like pulse deficit. Pulse, as you should know that pulse rate is the accurate measure of the heart rate except in condition pulse deficit. Pulse deficit, the pulse is not present. In this condition, the pulse rate is not accurate measure of heart rate. Usually the pulse is palpated on the radial artery because it is easily approachable and placed superficially. Normally we take pulse from the radial artery only because it is easily approachable and placed superficially. Now we will study the arterial pulse in different areas on the body. These areas are called pulse points. These areas where different arterial pulses are taken. These areas are called pulse points, which include temporal pulse over the temple in front of the ear on superficial temporal artery. You should know that temporal pulse is felt over the temple in front of the ear on superficial temporal artery in front of the ear. Superficial temporal artery is present here, and you put your 3 fingers, the index finger, the middle finger, the ring finger on the temple in front of the ear, and superficial temporal artery pulse is felt. Facial pulse on facial artery at the angle of the jaw. You know that jaw has the mandible bone, and the angle of the mandible bone is at the angle of the mandible bone. Facial artery is present, and when you feel the facial artery with your 3 fingers, and then you can take the facial pulse also. Carotid pulse in the neck along the anterior border of sternocleidomastoid on common carotid artery. You should know that in the neck the common carotid artery is present. It is not divided into internal or external common carotid artery so far in the neck, and so in the base of the neck in front of the anterior border of the sternocleidomastoid, here common carotid artery pulse is felt. The axillary pulse in axilla on axillary artery. Now you know that axillary pulse is felt in the axilla on the axillary artery. Axillary artery is present in the axilla, and you can feel with your 3 fingers, index, middle and ring finger, and the axillary artery and the axillary pulse. Brachial pulse in cubital fossa along medial border of biceps muscle on brachioradialis. Incubator fossa along medial border of biceps muscle on brachial artery. So brachial artery is present along medial border of biceps muscle. This thing you should know, this landmark you should know, that brachial artery is present along the medial border of biceps muscle, and so brachial pulse is felt here. Radial pulse over the thumb side of the wrist. Now this is very important that you should know the radial pulse. Usually this radial pulse is taken. It is very important pulse over the thumb side of the wrist. It is taken over the thumb side of the wrist between the tendons of brachioradialis and flexor carpi radialis muscles on radial artery. Now between the tendons, this artery is present between tendons of brachioradialis and flexor carpi radialis muscles on radial artery. The radial artery is present between the tendons of brachioradialis and flexor carpi radialis. So this radial pulse is taken from here. Ulnar pulse over the little finger side of the wrist on ulnar artery. So ulnar pulse is taken off the little finger side of the wrist on ulnar artery. Femoral pulse in the groin on the femoral artery. Popliteal pulse behind knee in the popliteal fossa on popliteal artery. This femoral pulse is taken in groin on femoral artery. Groin area and femoral artery is taken. The pulse is taken from here. Popliteal fossa behind knee and popliteal fossa on popliteal artery it is taken. Dorsalis pedis artery, it is present in foot and over the dorsum of the foot. This artery, you can feel this artery, and over the dorsum of foot on dorsalis pedis artery. Dorsalis pedis artery is present on the dorsal surface of the foot, and you can feel this pulse here. Tibialis pulse over the back of the ankle behind medial malleolus on posterior tibial artery. Now you should know that tibialis pulse is present over the back of the ankle behind medial malleolus on posterior tibial artery. Examination of pulse. I have told you earlier that pulse is examined by placing tips of 3 fingers. Those are index finger, middle finger and ring finger on the artery. Don't palpate the pulse with 1 finger or 2 fingers. Instead, palpate the pulse with 3 fingers, index finger, middle finger and ring finger on the artery. Observations made during examination of the pulse. Now we will discuss them in more detail. Number 1, the rate. The number of pulses per minute is pulse rate. The number of pulses per minute is pulse rate. It is 72 beats per minute in adults. Normally it is 72 beats per minute in adults. And the number of pulses per minute is pulse rate. It is 72 beats per minute in adults. Variations. So the conditions which alter heart rate also alter pulse rate. So this is the rate, and its value, normal value 72 beats per minute in adults, range is 60 to 90, and so pulse rate increases. In which cases the pulse rate during exercise, the pulse rate increases. In fever, the pulse rate increases. Anemia, in anemia also increases the pulse rate. Emotional conditions such as anger, anxiety or any other, they also increase the pulse rate. Pregnancy also increases the pulse rate. Hypersecretion of glands especially, so or sweating, or so that is the hypersecretion, and pulse rate increases in hypersecretion. In hyperthyroidism the pulse rate increases. Pulse rate decreases. In which conditions? In sleep the pulse rate decreases. Hypothermia, low body temperature, hypothermia. Hypothyroidism, the pulse rate decreases in hypothyroidism. If there is incomplete heart block, then the pulse rate decreases. As you know, in complete heart block there will be no pulse, but if there is incomplete heart block, and pulse rate decreases. Now the second characteristic is rhythm. The regularity of pulse is known as rhythm. You should know that the pulse comes in regular intervals normally, and if its regularity is maintained, then that is the normal rhythm. The regularity of pulse is known as rhythm. Under normal conditions, the pulse appears at regular intervals and is known as the regular rhythm. So under normal conditions, the pulse appears at regular intervals and is known as regular rhythm. The rhythm of the pulse becomes irregular in conditions like atrial fibrillation, extrasystole, and other types of rhythm. I must say that you should memorize these diseases in which pulse rate increases or decreases. You should know them, or rhythm in which the conditions in which the pulse rhythm or character or volume or delayed pulse is there, in which case it increases or decreases. You should memorize them. These diseases, you should have to memorize these diseases. So extrasystole and other types of arrhythmia, the pulse rate becomes irregular. The irregular rhythm of the pulse is of two types: the regularly irregular and irregularly irregular. So two types of rhythm of regular rhythm is normal. Irregular rhythm is of two types. The regularly irregular, a premature beat of pulse occurs at fixed intervals of normal beats. It occurs during digoxin toxicity. You should memorize digoxin toxicity. A premature beat of pulse occurs at fixed intervals of normal beats. After every 2 or 3 beats, a premature beat occurs. This is known as regularly irregular rhythm. And if it is irregularly irregular rhythm, then in this rhythm pulse there is no fixed pattern for the premature beats and they occur irregularly. It occurs in atrial fibrillation. So you should know that there is no fixed pattern for the premature beats and they occur irregularly. Character of the pulse. The character of the pulse. Now you should know the character of the pulse. The character of the pulse denotes the tension and the wave of the pulse. You should know that the character of the pulse denotes, number one, tension and the wave of the pulse. Normally the wave of the pulse or the tension of the pulse increasing or decreasing. Tension increases, tension decreases, and so the wave of the pulse increases and its voltage increases and decreases. Normally it is not possible to detect the different waves of the pulse. Normally different characters are not felt because but in certain conditions they are felt. In certain diseases they are felt. Normally it is not possible to detect a different waves of the pulse. It is or slight variation in the character or form of the pulse. Normally it is not possible because slight variations occur and you cannot detect them by palpating the pulse. However, the character becomes prominent in some abnormal conditions. However, the character becomes prominent in some abnormal conditions like slow rising pulse, in which there are 2 upbeats. There are 3. I am giving you 3 characters of the pulse. Slow rising pulse, in which there are 2 upbeats. There is a slow upstroke to begin, which is followed by another small upstroke before it reaches the peak. It occurs in aortic stenosis. So one stroke occurs, and then the second stroke also occurs before the pulse reaches to the peak, and this is the slow rising pulse. Second pulse is the collapsing or water hammer pulse, in which the pulse wave exhibits a normal upstroke but a rapid downstroke. It occurs in aortic regurgitation. And now you should know that in collapsing or water hammer pulse, both are the same. Water hammer and collapsing are both used for this type of pulse character. Pulse wave exhibits a normal upstroke. A normal upstroke is there, but a rapid downstroke. Instead of the wave should reach at the peak and fall regularly, there is a rapid downstroke, and so after normal upstroke there is a rapid downstroke and it doesn't reach to the peak as it should reach and normally, and it occurs in aortic regurgitation. Pulsus paradoxus, in which the pulse becomes very strong and very weak, alternating to respiratory cycle. The pulse in this condition is feeble and impalpable during inspiration. During inspiration the pulse is feeble and impalpable, and expiration the pulse is not normal but high. It occurs in bronchial asthma and constrictive pericarditis. So this very strong and alternating to the respiratory cycle, the pulse becomes very strong, expiration, and in inspiration it is feeble and impalpable during inspiration. It occurs in bronchial asthma and constrictive pericarditis. Volume. It is the determination of the movement of the vessel wall produced by the transmission of pulse wave. In simple words, you should know it is the movement of the vessel walls which is produced by the transmission of pulse wave. So movement of the vessel wall shows the volume of the pulse. As the blood vessels contain the blood and its volume, if it increases and decreases, it pushes the walls of the blood vessels, and so in this way the volume is felt, the volume of the pulse is felt. It depends upon the condition of blood vessel. If the condition of the blood vessel is in good condition, then volume of the pulse, you can determine that it has elasticity, it can be stretched to greater compliance, And so if the condition is bad, then it doesn't stretch to that levels, the arteries become rigid, and especially at old age, then the volume of the pulse decreases. High volume, you should know, high volume occurs in fever and aortic regurgitation. Low volume occurs in hypovolemic shock and heart failure. So high volume occurs in fever and aortic regurgitation, and low volume occurs in hypovolemic shock and heart failure. As we know that in shock, in any hypovolemic shock, the volume of the blood is decreased, and so the shock occurs, and hypovolemic shock occurs. In heart failure, when the heart doesn't pump the blood in further direction to the arteries, then also the blood, there is no blood available, there is no volume, and so it is the low volume of the pulse. The pulse is also of low volume. So delayed pulse. Sometimes the arrival of pulse in certain peripheral arteries is delayed. Now you should know that in certain conditions the arrival of pulse in peripheral arteries is delayed. Two such conditions are radiofemoral delay. When you while palpating radial pulse and femoral pulse simultaneously, there is short delay in the arrival of femoral pulse wave. This delay indicates the coarctation of aorta. If you simultaneously at one time palpate the radial pulse and the femoral pulse, there is a short delay in the femoral pulse, in the arrival of the femoral pulse wave, and this delay is known as radiofemoral delay, and this delay is indicated in the coarctation of the aorta. Now radial delay. Both the radial pulses are examined simultaneously, and sometimes the arrival of pulse is delayed on one side. This indicates the narrowing of large artery due to atherosclerosis. So both the radial pulses are palpated at the same time simultaneously, and sometimes the arrival of pulse is delayed on one side. Either the right radial pulse is delayed, or left radial pulse is delayed. It is usually due to the narrowing of large artery due to atherosclerosis. You should know this. So requirements we are performing now. After all that information I have told you, if you have all the points in your mind which I have told you in our previous video clips, then of this pulse, practical pulse, then you should know that what to do and what not to do. So we move to the actual practical and requirement, subject and examiner. Examiner you should need, and then the subject or the patient. Subject is normal, having normal body functions, and patient is having abnormal body functions. So procedure: to assess the rate and the rhythm, the radial pulse at the wrist is examined. You know that you have to assess the rate and the rhythm. The radial pulse at the wrist is examined. It is best felt with tips of the fingers, with subject's forearm being pronated and wrist slightly flexed. This thing is very important, that when you feel with your tip of fingers the subject's pulse, especially radial pulse, the forearm should be pronated slightly, and the wrist should be slightly flexed, and the forearm should be slightly pronated. In this condition you will be palpating the radial pulse. The rate of the pulse is noted in beats per minute. Know the rate of the pulse, then count the beats for not less than 1 minute. If you are assessing the rate of the pulse, you should not count the beats not for less than 1 minute. Note whether the rhythm is regular or irregular. You should then, after that, we should see that rhythm is regular or irregular, or if it is irregular, which irregularly irregular or regularly irregular. Observe the character of arterial pulse by palpation, and then after that you will assess the character of the pulse by palpation, and now estimate the volume of the pulse. Then you will estimate the volume of the pulse, then note the radial delay by simultaneously palpating the radial arteries. Now estimate the volume of the pulse, then note the radial delay by simultaneously palpating the radial arteries at both wrists, and then observe for the radiofemoral delay. Compare the above observed features of the pulse with the pathological variations mentioned before. So precautions of this practical are the subject you should give on your introduction and take the consent always. Every subject or patient must be physically and mentally relaxed. The subject or patient must be reassured and his her forearm and wrist must be kept in proper position to record the rate of the pulse. Count the beats for at least 1 minute. While recording the rate of the pulse, you should count the beats for at least 1 minute. This is the observation table, and this contains the serial number 1, 2, 3, 4, 5. You should know the characteristics of the pulse. So rate, rhythm, character, volume, delay. These are your observation. Blank space is present in front of the rate, rhythm, character, volume, delay, and you should write your answer whether it is normal. And now we have completed and we have finished our pulse practical.